The endocannabinoid system is throughout the body, and so it plays a role in many different systems. So typically patients will come in with problems like chronic pain or anxiety, depression, they may have seizures. So there are a number of chronic and debilitating illnesses that tend to respond to cannabis in most patients, not every patient, but 6 out of 10 patients will respond to cannabis. It's important to have that doctor-patient relationship because there can be side effects. Even though cannabis is a very safe product, it has a very high safety profile, there are adverse reactions, there are drug reactions, there are certain physical conditions that might be exacerbated or made worse with cannabis, and especially if the dosing isn't right. And then patients look for guidance from their healthcare provider. It's medicine, and so it's not any different from any other medicine. I think Maryland has opportunity to really present a really good medical platform for cannabis, and the type of community it is here, it's a little bit more conservative than the West Coast. You have a lot of highly functioning people who are suffering and would welcome the relief, but can't, they can't be mentally impaired or intoxicated from THC. I think that the Maryland climate, from what I've seen, is gearing itself towards those types of patients. A lot of patients who have never used cannabis, or it's been 30 years since they've used cannabis and they didn't try it again because they didn't care for it or they had an adverse experience with it. So I see it as being a place to really, for cannabis to shine as a medicinal. My recommendation for the industry would be to look at the older patients and the younger patients and approach it as a medicine and as a safe and effective medicine without the, the intoxicating effect of THC can be a benefit for some patients, but it can be an adverse reaction or adverse effect for others. And so I would hope that we will have more focus on reaching those patients who have been hesitant to try it.